So the recording has started, and I would like to present to you Dr. Luann Richardson. Dr. Richardson is a professor at Robert Morris University School of Nursing, mostly teaching courses involving mental health and advanced practice nursing issues. She earned her Doctor of Philosophy and Doctor of Nursing practice degrees through the University of Pittsburgh, while obtaining her undergraduate degree at the University of Alabama. She is certified as a family nurse practitioner, geriatric nurse practitioner, and psychiatric mental health nurse practitioner. Her academic interests include integrative care, geropsychiatry, I stumbled over that for a bit, just a little bit, and advanced practice psychiatric and clinical issues. Dr. Richardson has published numerous publications on advanced practice issues and has presented nationally. She maintains clinical practice working in settings that include older adults, those with general mental health conditions and substance use, and also supports those in underserved communities. Her previous areas of work have included cardiac, occupational, and women's health settings. Finally, she has been a faith community nurse for more than 20 years. So I'm going to turn it over to Dr. Richardson.
Hello, everybody, and welcome. And we're going to talk today just a little bit, about a half an hour or so, and a little bit extension into some questions, discussions, and stories. But we're going to look at pandemics and mental health. We're going to first compare the 1918 flu with our current COVID situation, and then look at some mental health issues. Now, some of you at CCBC may have read Last Town on Earth, the story that about a town that tries to protect itself and looks at the challenges that they face in the 1918-1919 flu. Most of us have never experienced the collective stress that's similar to a pandemic. Maybe the Great Depression, World War I, and World War II, the Holocaust are some examples. Since I've been asked to do this, we have had the Russia-Ukraine war. Okay, so if we look back to them, there's a dynamic about pandemics that goes back centuries and that has led to uncertainty, fear, chaos. There's also conspiracy, misinformation, lack of resources, isolation, lack of trust, loss, immunization controversy. All these things are not new. If you look back at the earlier flu, we had masks and there were controversy. We had protests and we had waves of increase and decrease. We were all told to improve ventilation. Countries blamed countries. We had distrust of authority, misinformation, and media differences. Woodrow Wilson was the president during the 1918-19 pandemic. And historians tell us that the government really didn't have much to say about the pandemic. They essentially downplayed it. What was going on is that World War I drew attention and resources away from the flu. So cities across the US were on their own to devise their own responses. And we learned from hundreds of cities that the earlier we started with more measures, staggering trolleys, closing schools, avoiding big events, and keeping these measures in place, those cities had about half the pandemic death rate as those cities that did not do that. Now with COVID, we're much more connected, urbanized, with more advanced treatments, and our government is much more involved. So this is back from the CDC during the 1918-19 pandemic. On your upper left, we have an influenza flyer on a streetcar in Cincinnati, touting the importance of ventilation during that pandemic. Today, public health officials still note that ventilation is the #1 measure to prevent COVID-19 from spreading. If you look at our upper right, you can see that public health officials went outside to conduct active business as a measure to decrease the spread of the virus. The CDC reports that The 1918 flu pandemic killed about 675,000 people. Our current pandemic is close to 1 million. So by raw numbers, it looks like the current COVID pandemic is most deadly. However, the US population was much smaller then, about a third of what it is right now. You can see that masks were important back then. And on your bottom right, you can see the waves of increase and decrease of the flu. So what we're looking at here is routine care, which is conventional. Here, things just go as usual. We're able to have fidelity to the patient. But as the need for care escalates, we move into the contingency and possibly the crisis stage. So we shift to a paternalistic point of view, relying on the experts. And in our crisis stage, we have to look at fairness and what is the good overall that we can do. And time is of the essence in care. So let's look at mental health in the pandemic. So there were very different early responses to COVID. Some who felt safe during the early COVID period, they thrived, especially those with social anxiety, those who were overworked, those who were able to work at home, or those that didn't like their jobs. It was a nice change. Others went berserk and couldn't wait to get back to normal. For some, too much togetherness with a small group of people with limited activities available led to some toxicities, and relationships suffered. That was especially true in college settings and in families that had too much together of us. So some of us enjoy aloneness and others of us felt very lonely. There was an increase in substance use worldwide. There was more partner aggression reported. And also we had an interesting phenomena with sleep. In general, a lot of people tended to go to bed later and get up later. That's what we call a delayed sleep phase disorder. So while many of us stopped going to the office, we quit getting groceries, and rightfully so, we stopped being with people. But what about those that couldn't stay home? Our healthcare workers, our first responders, our cashiers. You can imagine there was some perceived unfairness. We all felt some degree of loss during the pandemic. However, it was all different. For some of us, there was loss of control, routine, income fluctuated, loss of privacy in some cases. Our social lives suffered. We didn't get to have the celebrations. Our relationships were cut off. A lot of weddings canceled. We didn't even get to attend funeral. Our young people didn't get to date for close to a 2-year period. Some of us didn't get to go to our routine health appointments. Some of us lost friends and loved ones. But for all of us, we had a loss of predictability. And with that comes stress. And there are different ways that we exhibit stress, whether it's physical, emotional, behavioral, or cognitive. And you can just look at this slide and see how you experience stress. Remember that the pandemic can cause physical symptoms, as mentioned. That some of us get muscle tension, headache, GI effects, sleep issues, as we've mentioned. Some of us were fearful, angry, difficulty regulating emotions, perhaps behavioral. Some of us did not want to follow the restrictions that were put in line with the pandemic, despite the possibility of endangerment to others. As mentioned, conflict or withdrawal were also possible. But what made working in healthcare during the pandemic especially stressful? Well, for one, the pandemic happened without much warning. And most nurses in the US have had little experience practicing medicine in a compromised environment, such as the pandemic. Lack of equipment, lack of staff every day. Was this really something that they signed up for? In addition, patients changed, their conditions changed quickly. And this was confusing to both nurses and family. And optimal care just wasn't possible because of lack of resources. And as you can see on the slide, we had fear of transmission, and we were working in this setting all day long. Early on, we did not have protective equipment, and resources were scarce. We didn't have a lot of control, and there was a lot of uncertainty. We didn't know best treatments. Social distancing was very difficult in a healthcare setting. We had to work long hours and make tough decisions, and were often blamed for things that we had no control over. We had to be surrogate families for many who weren't even allowed in the hospitals. We had to carry out new policies and respond to patients asking if they were going to live or die, knowing that that answer was about 50-50. And we did this day in and day out, 24/7, 365 days a year. And then after working for a long day, we had to go home and begin again with the family stresses of the pandemic. So here we look at what's called the resilient zone. And this is a state of well-being of mind, body, and spirit. And when we're in this resilient zone, we can kind of handle the stressors of daily life. Naturally, we go up and down. We may get annoyed and angry, but we don't feel like we're going to blow up. We may feel a little sad, but we're not washed away in our sorrows. But this happened if we go out of those blue lines that are there. This is when we begin to feel vulnerable, and this is when we may need just a little bit of extra help. There may be something that needs to change, recognizing that we all have different thresholds for stress. So here we have the kindling effect. This is what happens with repeated stress, the kindling effect. It's repeated or recurrent trauma, and this has changes on the sympathetic nervous system, and it elevates our underlying baseline stress level. So our baseline stress levels that start out very calm never seem to return to that calm level with repeated in each subsequent episode of stress. And this kind of leads over time to what we call a hypervigilant state. So this is a 2-week period of a nurse's life during the pandemic. And as you can see, looking at this slide, a lot of our nurses felt overwhelmed, anxious, irritable, sad, lacking meaning, angry, and lonely. And then if we move on, we see that many of our nurses had trouble eating and sleeping, and this led to poor choices that affected their own health as they were caring for other people. So when we're looking at all this, it's important to know yourself in reference to fears, relationship, and asking yourself what brings you peace, what needs to change. Are you energized by alone time or not? Are you able to accept that little goes as planned and then plan for that? So just know your warning signs. And we're going to come back to some of these questions at the end, and I'd love for you to share your thoughts. Overcoming negative self-talk. So sometimes we use these negative thinking patterns. They're automatic thoughts, and they falsely convince us that something's wrong, but without evidence. So let's look at a couple examples of these cognitive distortions. Catastrophic thinking. You expect the worst outcome in any situation. For example, if your boss schedules a meeting, you assume that you're going to be fired. And your thinking spirals from there. If I get fired, I'm not going to be able to pay my bills, and I'm not going to be able to stay at home, without the evidence of that happening. Discounting the positive. When something goes right for you, you don't take credit for it, or you chalk it up to good luck. Or you might receive many compliments on something that you did well, but you choose to focus on the one negative comment that happened. Emotional reasoning. You rely on gut feelings over objective evidence. For example, I feel like I'm a bad student or a bad mom, therefore I must be a bad student or a bad mom. And finally, overgeneralization. Here, if a relationship ends poorly, we think that we're not worthy of love, And as a result, we conclude that we should never date again. So that leads us over here to this right side. We want to catch those automatic thoughts, challenge them, and replace them. And some of the examples are listed for you, but I'll just do one. I'm a loser. You challenge that and replace it. No, I'm not a loser. I'm a caring, competent professional doing the best possible job I can in a very difficult situation. So healthcare workers in COVID. So healthcare workers initially were seen as heroes. We got thank you notes, food was given to us, appreciated. But this changed to almost hostility as the pandemic progressed. Wait times in the ER lengthened. Families weren't allowed to see their loved ones, some of them saying that we could have done more. The demands were almost impossible. The long hours, the overtime, some of us doing the work of two due to the shortage, all while skipping lunch and staying late. Some nurses have worked more than 2 years without a day without seeing COVID patients. We've worn masks daily for long hours, sometimes causing headaches and pressure sores on our nose, cracked lips, and rashes. It's estimated that about 20% of all healthcare workers left the field. And the vaccine really didn't stop ICU admissions. That's intensive care admissions, as some of us thought. And this was unexpected that so many of us did not want to get the vaccine. One nurse told me that she had a patient about to be put on the ventilator who still didn't believe that she had COVID. Having said that, a few baby boomer nurses, older nurses who were retired, came back into nursing to help with it. Other nurses became creative and implemented changes. Virtual rounding, using iPads to connect with families. One physician, an ER epidemiologist who works with infectious diseases, was encouraged by his daughter to stop. He was 74 and she didn't want him to get sick. But he told her that he had waited his whole life for something like this to happen so that he could help out. Okay, oops, I think we skipped one here. So here we're looking at moral injury and distress, compassion, fatigue. I want to touch on these things before we move on. Moral injury is actually a term used by the military when actions need to be taken that aren't congruent with our values, such as rationing care and rationing time. So as you could imagine, this leads to burnout and compassion fatigue with intense feelings of guilt. So it's during these times that we need resilience. And what is resilience? Well, it's our capacity to maintain well-being and respond effectively to uncertainty. And all of this begins with awareness, understanding how we deal with this uncertainty, this powerlessness, and all of these difficult events. Keep in mind that fear, anxiety, anger, sadness, grief, these are all normal feelings during these crises. But acknowledging that vulnerability is the beginning of healing. We can't change any situations, but we need to sometimes just change ourselves and accept that we will do what we can do and only that. So if we move down the slide, we see stress disorder, and this is usually temporary, where individuals might have trouble sleeping, they're worrying a lot, feeling guilty, they actually ignore their emotion and sometimes become detached. And when we become detached, we feel like we're in a dream state, and this too can affect care. Post-traumatic stress disorder. Nurses are no strangers to death. But remember, 27,000 people died in just New York City in a 6-week period, March, April 2020. And these people relived their trauma over and over with recurrent triggers. Some experienced nightmares, numbness and avoidance, and that hypervigilance where we always feel we have to be on guard. And it's that constant nature of that high level care that can actually alter the nervous system, and that trauma gets caught in the body. A lot of nurses were frustrated that patients didn't respect the virus. They continued to go out to parties, not wear masks, and not take any preventative measures. So in caring for nurses and caring for ourselves, that's real. I mentioned nurses, but it's really any of us. Self-compassion versus self-criticism. With compassion, we're kind to ourselves and recognize our common humanity, and with that, being mindful. Self-criticism, on the other hand, we judge ourselves and isolate ourselves and use those cognitive distortions that I mentioned on an earlier slide. So if we go to that self-compassion part, we see that this activates what we call the parasympathetic nervous system, which has a very calming effect. And with self-criticism, we activate the sympathetic nervous system, and that has an activating effect. So when we practice self-compassion, we learn to remain calm in the face of failure, rejection, and criticism. We actually deactivate the threat system and activate the care system. Self-compassion and mindfulness. With self-compassion, we have self-care. I choose to do the things that soothe me, and I accept myself in this present moment just as I am. And then we move to mindfulness, which might help with that. I accept the present moment without judgment. So with mindfulness, we actually experience that acceptance. What I am experiencing, we're looking at that. We allow ourselves to feel suffering, but with awareness. And we sometimes can use mantras to help us. I accept myself as I am. These brief sayings, I am enough. Today, I will treat myself with self-compassion and kindness. I will let go of the old and make room for the new. All of these emotions or these thoughts promote positive emotions. So self-care, this means taking an active role in protecting your well-being during times of stress. Self-care is not self-indulgence. It is not self-pampering. It's not substance use. It's not excessive spending or any excessiveness. But pay attention to what comforts you, whether it be mind, body, spirit. You can see several examples here. And some of these will resonate with some and not others, and vice versa for other folks. But physically, we all need to take care of ourselves. Socially, pay attention to healthy relationships and be very cautious with toxic ones. Send a note to a friend. Intellectually, learn something new. Professionally, learn that it's okay to say no. It's okay to have time away, even with the nursing shortage. A no phone day, asking for help, thinking of ourselves as our own best friend, recognizing that we do have the resources. Sometimes it means just taking a few deep breaths, even if it's in our car, recognizing that it's okay not to feel okay. Spiritual, talk with God, volunteer, think deeply about the things you love, and practically declutter, simplify your lives. All these things mean that we're taking care of ourselves so that we can better take care of others. And this is a continuation, really, of slide 19, with just recognizing triggers, separating home from work, having some fun. Recognize that there are crisis resources available if you think things are escalating for both yourselves or someone else. The number is there. There's also a text number. 741-741 is available 24/7. So remember that unrealistic expectations can take a toll on ourselves. When we suppress our feelings, they often surface with other things, such as depression, anger, fatigue, illness, and burnout. Having said that, we still need to retain and spread hope and not fear. There's a saying, it's better to light one candle than to curse the darkness. If we can recognize all of this negativity and all this stress as a growth experience, that can be positive for ourselves. But all of these strategies, as you can see, are usually simple things. Fresh air, being on your porch, looking forward to going home with your pet. If you look here at your bottom right, mindfulness, and we're going to do a little exercise later on where we actually place our hand over our heart. But mindfulness has been shown to activate the anterior insula in the brain. So we'll look at that just a little bit later. But take time to feel gratitude in the everyday pleasures. For some of us, medicine and science can only take us so far, and it's our faith that will have to take us the rest of the way. For others, what gives you meaning? What keeps you going every day? If you explore these things, it can sometimes help all of our mental health uh, baselines, in general. So moral resistance is actually a form of self-care. It's courage and confidence to confront stressful situations when it's uncertain about what's going to happen by following and trusting our values and beliefs. What it does is allows us to maintain this perspective, keep the situation in context, and understand that some conditions are just out of our control. So during crisis, we have to remind ourselves that life is different right now. And again, we bring mindfulness up again. These breathing exercises, just being mindful of the present, sometimes before we go into a patient's room, these can actually strengthen the parasympathetic nervous system. Remember, that's that calming system to combat stress. And keep in mind, we were not meant to cure all, but we were meant to care. So we can't do this alone. Discounting and ignoring the mental health of nurses has both short-term and long-term consequences. Healthcare professionals often don't realize that they too need to be cared for and that it is okay to feel vulnerable emotionally. It's the duty of the institution to provide tools that keep our staff safe and protective, and this includes the emotional and mental aspects of health. So you can see some examples how institutions can be supportive. It might be focus groups, uh, in collaborative focus groups with different professional groups in there at the same time, interprofessional groups. Flexible scheduling allows our nurses and healthcare folks to have some control. Access to healthy meals is a win-win, and compassionate leadership allowing nurses to be home. Some institutions have implemented what we call serenity rooms, where the nurses and healthcare professionals can escape to with all the hustle bustle that is in hospitals. It's a room that has a very calming atmosphere with no loudness, no monitors, healthy snacks are available. Staff are allowed to decompress here. Previously, they literally would run to a bathroom for a minute alone with themselves. Another thing that is happening, therapy dogs are now making rounds in the ICU, and it's beneficial to both patients and staff. It's very calming, and physiologically, it's been known to release serotonin, which provides a calming effect. So society response. So we are a rebellious society. That's good and bad, but many of us just don't like being told what to do. Masks, we've all heard masks don't work. Masks don't work. Well, they don't work if we're wearing the wrong ones or wearing them the wrong way or wearing them partially. Most folks probably thought of themselves over others. Not most folks, some thought of themselves over others. Immunizations. The vaccine is too risky. Yes, all vaccines have slight risk. In prior centuries, so many people died before reaching adulthood of smallpox and other infectious diseases. Smallpox did not discriminate. Kings and queens, high-level authorities died along with their children. Lots and lots of children never made it to adulthood. So inoculation or immunization with an infectious material was a new possibility. But as you can imagine, it was filled with fear and skepticism. Just imagine somebody telling you that they're going to inject a weakened virus into a young, healthy body. Some folks were willing, but others were very resistant, just like we have today with COVID. So this is not new. That's, I think, the point here is that these controversies have went back years. And now we have the internet available with multiple points of view. Keep in mind that a little bit of knowledge about something is often dangerous, and that's what we've seen. Now, from a totally different perspective, I do think that we have the right to not accept things in our body that we don't know enough about. And that is how a group of folks felt, and that is a right. But back to science, with COVID, there has been controversy over best treatments. And there also has been lack of consensus. In general science in medicine, we generally don't know what best practices are until they're studied and we allow time to pass. But this can't happen with a pandemic. But some in the media thought they were experts, and all this did was lead to more confusion, misinformation, and distrust. Another thing that happened was that our public saw some treatments as all or nothing. They worked or they didn't. But in reality, it's very gray. And it's likely that some treatments worked for some, but not others. So we didn't have all the answers, but we did have ways to reduce spread, but not all were on board. So with any pandemic, we have not only a public health issue, but an attitude issue. And we've learned with the past two pandemics that they go hand in hand. We learned that during world crises, surprisingly, they don't always unite us. Just think, the first year we had riots, in our second years we have a war. We were blessed that the Omicron variant was less deadly than the original variant. This was not the case in the 1918 variant, where the flus in 1918, the deaths were much less than the subsequent year death rate. So now we're going to just move on to just a little bit of stories. We're going to do an exercise, and I want to see how you're doing and have your input. But I'm going to begin just a quick story to transition. This is a true story in a local facility. A man sits beside his wife's bed in a hospital, both in their early 60s. She came in 9 days earlier with COVID, and 2 days later she was in the ICU. Her husband says to you, she's a fighter. I'll tell you, she won't let COVID beat her. I've known her for 40 years. He proceeds to tell you about her history, how they met, their years together, her beautiful eyes. He says he's cried more this last week than his whole life. He was immunized, but she was not. But she promised to get the vaccine as soon as she was discharged. 6 days later, she died. Another patient that I had, Carol Lee, I don't want the pandemic to end. She tells me that over and over. And this was because her COVID story would never end. Her husband died during the pandemic. And she felt that when things got back to normal, everybody would proceed with their own normal life, but she would never be able to do that. And as the pandemic continued, we all had restrictions and were in it together. And finally, a story of a cashier who was very careful at work, very careful at home during the early pandemic because her husband was older and had COPD. Well, working as a cashier, she did get COVID, and then he did too, and he died. And afterwards, she felt so alone and angry at the circumstances. Wasn't even able to grieve as they weren't able to have a proper funeral. And all of this was on the verge of retirement that was to come 2 months later. Now, having said all these, there are similar stories of recoveries. So we had to remain hopeful not knowing why some people died and other people didn't. So going back to nursing, as nursing, we never know the impact that we may have on patients. They might not remember your name, but they will remember the appreciation they felt when you gave them that warm blanket, or talked to their family, or followed up on whether they were taking their medicines correctly, or just gave them hope. So to end, nurses do make a difference. So now we're going to transition, and I want to hear from you. But as we transition, let's do this exercise together. And it's called hand over heart. Okay? Again, been shown to release oxytocin and healthy neurotransmitters to calm the nervous system. So think of a situation that is stressful to you, and then just take 2 to 3 deep, long breaths. Inhale for 4 counts, hold for 4, and then out for 7. Let's do it together. In, 2, 3, 4. Hold, 2, 3, 4. And release, 2, 3, 4, 5, 6, 7. Now you do it once. Feel the touch of your hand on your chest. Feel the warmth, the gentle touch of your hand. Feel the rising of your chest with your breath. And linger with that feeling for a few more seconds. So as you do this time and time again, notice where your stress registers in your body. For each of us, it can be very different. So here's what we can do now. Let's just talk about how you felt. Look at any of these questions. What one thing did you learn about yourself during the pandemic? What was a good or maybe not so good thing? Was there a comfort measure? Is there a message you would leave? Is there something society got right or not right? And because we don't have too much time, if one of these jumps out, or if you have a special story that you'd like to share, I would love to hear that. Let's start with, is there any good thing? Was any one thing that was good or that you learned about yourself? For me, I learned that I am energized by alone time. I don't think I knew that before, but alone time can be energizing for me. Anything? Yes.
So for those of you that are participating, you're free to turn on your microphones. You're free to chat in the chat box if you want, whichever you're more comfortable doing. But Dr. Richardson, I'll respond to your question.
Okay.
I think I'm an introvert. So as an introvert, I enjoy a serious amount of alone time. So I enjoyed not having to necessarily be out in public, but that also meant that I was home a lot with my family, and I found that to be incredibly, I adore them, but it was incredibly challenging to sort of be cooped up in the house.
Yeah. Yeah. Very, very honest answer and very common. Yeah. So you may have known that you liked alone time before, or did that just reinforce it?
Yeah, I knew I liked alone time, but it was, I felt, it felt different because I mean, I was home all the time. When the pandemic hit, I was teaching from home at that time when it first hit, and I kind of liked it on some level. I mean, I didn't like what was going on outside my home, with COVID and storage rooms being empty. That was stressful, but I kind of liked being home. I wonder if some of the people who are participating today, Bailey, Caitlin, Jacob, and Jaden. Oh, Caitlin responded.
There you go. Yeah.
So
Yeah. Okay. Yeah. Hang out together, Caitlin. Yeah, Caitlin. Yeah. Yeah. You hung out together. You already knew that you enjoyed time alone. How about the slower pace? Did you all like that slower pace? Yeah. One thing was good was more time with your daughter. Absolutely. More time with your own children. A lot of folks tell us that they enjoyed more time with their pets. They enjoyed less time commuting, were some other answers that we had, and just a solidarity with each other and with nature. Those were some of the responses that we had. Yeah. And some of this will create a permanent change. Working from home will probably, and these meetings like we're having now, we probably would have never had this type of meeting 2 years, 3 years ago. Expenses, we all got to save a little. Some of us got to save some money. Others lost our jobs and we didn't have income coming in. So we had all different kind of response in reference to income. Yes. Anybody else learn something about themselves or see something good about themselves? Or maybe not so good things about the pandemic?
I was thinking we were talking about some of the good stuff, but I was thinking about when when I first went grocery shopping. At the time when the pandemic hit, I was living in Kansas at the time,
Mhm.
um,
Okay.
and so it took a while for everything to shut down in Kansas. It
Mhm.
hit the East Coast first. Here in Pennsylvania, you shut down well before Kansas shut down everything.
Okay. Hmm.
And I remember walking into a Walmart just to do some grocery shopping when the pandemic first hit, and seeing the empty store shelves. And that's when it finally, I think it took that long for it to sort of hit me, and
Hmm.
that stress. By the time I left the store, I was crying. I had never had that sort of response to stress in that way. And I'm curious
Yeah.
if the other participants
Mhm.
experience. I mean, we talked about some positive things, but what about some of the negative things?
Yeah. Yeah. Uh-huh. Just mental health for some of us suffered, which has been said. And as you like that hoarding effect, a lot of us like hoarded, and they showed scenes on TV of people pushing people down in the stores to get what they wanted. Some of those things might have been negative. We had unemployment, people stopped going to work. Our deficit is bigger. There was a lot of loneliness. Like you had mentioned, Stacy, too much togetherness for some of it. How about the school changes? Pros and cons. We had some beauty that we can learn like this, but other younger people just could. And as a psychiatric nurse practitioner, I can tell you I had multiple examples where young people just could not learn. They forgot how to learn. That delayed sleep phase entered into their lives, and they just could not get up until, believe it or not, 1, 2 in the afternoon. Mostly our young people, but it also affected some of our older people. So there were probably some alteration in child's development because they didn't have the social interactions. I had a few families that, with the abrupt going home to work and to school, they didn't have computers for their children to do the remote learning. So the computer factories sold out of computers within a month, and they were just looking for secondhand computers so that children could learn with the computer. And a lot of OCD, that's obsessive compulsive disorder, with hand washing, and people just became so afraid of COVID or any disease that they were just constantly washing their hands, and they wouldn't go out at all. So yeah, so not seeing family was a hard thing. um, Caitlin just says, missing family members who were ill, not getting to see their doctors was such a big a thing. A lot of uh, elective surgeries are going on right now. because they weren't able to go on for the last 2 years. A lot of preventative measures, colonoscopies and mammograms and lab testings. There's a lot of that going on right now, but there's still a shortage of nursing. So a lot of these elective surgeries can't take place because the staff is not back to the level that it was before the pandemic. So this is a great time to be in healthcare if you want to work and help people and work hard because we need it. But these comments are wonderful. Staying away, it's mentioned in the chat, just staying away from family for fear of getting somebody else sick was difficult. And college was hard. It was a very, very difficult year, especially that first year, where there weren't activities going on in college, and we had to stay with the same group of people. We weren't able to go to restaurants. So college is wonderful for learning, but it's also for socialness. And a lot of our young people got really homesick and wanted to go home. So it was a tough year, and we learned a lot, and a lot of mental health suffered. What about changes to society that will go on and continue? For example, work at home is probably a new normal for some, and that has good and bad to it, and I can speak to that for a minute. But does anybody have any comments on that? Just what has changed forever? What has changed forever? What has changed? Work at home has. And for our young people, usually when you get out of college and you get your first job, work is social. So we miss that social connectedness if we're working at home all the time in our pajamas and not getting ready and not having those interactions. For those who have children or families, it's a little bit different of a story, and it can actually be more beneficial. We have that less commute time, and we're already socially involved with our families and running our kids around. How about the
I, I,
pay? Yes. Uh-huh.
I have a question that's kind of
Yeah.
connected to what you're talking
Mhm.
about. Earlier in your presentation, you talked about how healthcare workers for the past 2 years have only known COVID. And
Yeah.
it made me think about our nurses who are going to be, graduating and going out into the field, or who had graduated within the last two years. All they've
Mhm.
known of nursing throughout their entire career is COVID. And I wonder
Yeah.
if there's any research or that's happening right now that will study the long-term effects of
Yeah.
COVID on healthcare professionals, particularly
Yeah.
those who are entering the field now.
Yeah.
I mean,
Well, as
will they be
yeah.
able to go back to the way it
Yeah.
was pre-COVID?
It will take time. I think that we may be wearing masks in the hospital long term, because of the reduced reduction in infection. A lot of our students weren't allowed to be on COVID units, all over, not just at Robert Morris, but all over the. In general, at least that first full year, they weren't allowed to even be in hospitals. So the the disadvantage there is that they didn't get enough experience in the hospitals and healthcare settings because we had to shut down. They were not allowed to be even in the hospitals for a good 3 to 9 month period. So a lot of our nurses graduated feeling that they did not get enough experience in the hospitals or even at outpatient settings. So we had to do a lot of catch up work, but that can happen really fast. Um, like just now, there's those nurses that I talked about who have just seen COVID patients are already seeing more and more patients, and just learning to have universal precautions and be more careful of it. When you learn COVID, a lot of different things go wrong with the body before death, and they may have kidney failure, they may have liver failure, they may have lung disease, they may have heart disease, they may have arrhythmias. So the student can learn a whole lot about the body just from one condition. But while it's going on, a lot of other things are going on too. Yeah. So it's catch-up time for sure. And there was research on the SARS virus that was up in Canada, about 10, 12 years ago, that we had a very contagious SARS virus. And they did some studies with those nurses, but that was very short and contained. It only lasted like a 2 to 3 month period. But some of those nurses did develop post-traumatic stress syndrome in the long term and had difficulty caring for themselves and for patients for several months, if not years afterward. But these are all things that we're looking at now. Again, it takes time to accumulate the research data, and these likely would involve longitudinal studies. Yes. Or one other thing, how about commute pay? So with those working at home, they don't have to commute. They don't have to have a big wardrobe. But what about the folks who mandatory have to drive to their location for work? I wonder if there will be commuter pay, something like that, because there's a disadvantage to those who don't have the ability to work at home. That's just a thought. I don't know that that's medical or not, but when we talk about changes to society, I see work at home, and those in retail or working at restaurants, they have to go to the place, and those typically aren't terribly high paying jobs, but there's a definite mismatch there on how we're going to handle that as a society moving forward. Any other comments or stories? I know college can be hard. Being with family can be wonderful. It can also be challenging. No. Yeah, I appreciate your comments in the chat. I see several of you did that, and again, they resonated with the same, uh, you know, just feeling on the outside, difficulties with friends and with our media. Um, some of us have been permanently changed from outside work to working at home. And again, some of us thrive on that, and others of us become low and down and disinterested or just flat. Yeah. Other comments? It's been a pleasure to talk to you all, and I'm available for additional questions, comments, stories, anything. But if not, I hope you learned at least one thing that might have been interesting, or that you want to learn more about, or that intrigues you from a personal, professional, or just life standpoint.
Thank you so much, Dr. Richardson. This was a truly engaging presentation, and I know it's going to have, as I said, I'll be able to share this video with many other students and faculty and staff here on campus. So I think this is going to have a long-term impact on the community here at CCBC. So thank you so much. And thank you. Thank you to everyone who joined us today.
Yes.
It was wonderful having you here, and you're a really, really engaging audience as well. So thank you.
I agree, and thank you for the comments too. I'm looking at all of them now, and I really appreciate each and every one of them. Caitlin, I hope your grandmother does well, and all the other students who have commented. Thank you. I appreciate your comments. Thank you. Yeah.